morning, this is CP News. I'm Corinne Mueller, and today we'll look at the history of cerebral palsy, current treatments, and how symptoms develop, plus a special medical forecast with our health correspondent. Here's Kristen Tarter with our breaking news. What is cerebral palsy?
Thank you, Corinne. Cerebral palsy is a group of disorders affecting movement, muscle tone, and posture, caused by early brain injury or abnormal brain development. This is a non-progressive but lifelong condition which affects mobility, coordination, and sometimes speech or vision. Cerebral palsy is caused by damage to parts of the brain that control movement and affects the primary motor cortex, cerebellum, promotor cortex, and basal ganglia. Finally, cerebral palsy is caused by damage to the brain's white matter, gene changes, bleeding in the brain, and lack of oxygen. Now over to Kiera Archer with our historical report.
Thank you, Kristen. The earliest evidence of cerebral palsy was found in a mummified Egyptian pharaoh named Siptah. And then in 1853, William John Little defined cerebral palsy and first described spasticity in infants. The condition wasn't originally called Little's disease. Then William Oster made the term cerebral palsy, and then in the 1980s, Sigmund Freud suggested CP results from prenatal brain developmental issues. But what about early treatments? Let's go to our medical history correspondent, Corinne.
Thank you, Kiera. Here's an overview of early treatments. In the 19th and early 20th century, treatment was active non-intervention and meant to correct limbs using braces, casts, and stretching. Later in the 20th century, experts treated it with tenotomies, which is a medical procedure that includes cutting of a tendon for correction, and resections, which is also cutting but of tissue or bone. In the mid-20th century, we got multidisciplinary treatments. Then, in the 1970s to the 1980s, they started using medications for treatment, such as baclofen and ethanol solutions. Then, for modern treatments, we started to use SEMLS, which stands for Single Event Multi-Level Surgery, which is just a more advanced procedure to correct deformities. A major misconception in history that were some of the doctors believed cerebral palsy came from birth trauma only, which would make these treatments ineffective. Treatments have come a long way. Let's check the modern medical forecast.
This is Kristen Tarter with today's neurological weather pattern. There are many different symptoms that come with cerebral palsy. In this case, we're seeing a high pressure system in the motor cortex. This can restrict movement and cause stiffness. There are three main types of cerebral palsy. Spasticity, which is caused by the motor cortex or tract damage, which causes muscles to overfire, creating spasms. Dyskinesia, this is caused by a basal ganglia injury, which causes involuntary movements. Ataxia, this is caused by cerebellar damage, which creates balance and coordination issues. Other symptoms can include mixed cerebral palsy. This is the combination of multiple affected areas. Gait, this is unusual walking style due to spasticity. Floppy muscle tone, which is a lack of muscle tension, which causes muscles to feel soft or limp. Hearing, vision, and language challenges are caused by damage of occipital lobe, Wernicke's area, and Broca's area. Let's take a look at why these symptoms occur. The timing of brain damage. The earlier the damage, the more severe the case is. Location and extent of brain damage. Depending on the location of the damage, the symptoms may change. Symptoms vary depending on which part of the brain is affected. Therefore, no two cerebral palsy cases look exactly alike.
Hello, I'm your health correspondent, Kiera Archer, with your health update. Firstly, let's introduce our treatment goal, which is not to cure cerebral palsy, but to improve mobility, independence, and the quality of life. For a treatment rundown, first we have physical therapy, which improves strength, balance, flexibility, and gait training. This helps to manage a normal tone, prevent contractures, and improve motor skills. Secondly, occupational therapy, which improves functional independence. This helps because cerebral palsy affects fine motor skills, and this will help with daily tasks. Then you have speech therapy, which supports communication and swallowing. This helps by training the motor speech muscles and teaching safe swallowing practices. Then you have assistive technologies such as braces, walkers, wheelchairs, and seating systems. The rationale for this is to compensate for weaknesses, improve posture, mobility, and prevent former deformities. Orthopedic interventions such as stretching programs, positioning, and splints. This is used to help control muscle shortening, joint deformity, and improve functions. Now we can get into the medications, which help to reduce spasticity. Examples are muscle relaxants, baclofen, and diazepam. It helps to reduce excessive muscle tone, improve mobility, and decrease pain. Botox injections into overactive muscles focuses on specificity relief, and improves particular functions. Then finally, there are medication for specific conditions, such as seizures, which have anti-epileptics, pain, mood behavior, and because many children have these commodities. Then you have orthopedic surgery, which corrects bone and muscle problems by lengthening tendons, hip surgery, and scoliosis correction. This helps correct deformities and mobility. Neurosurgical procedures such as SDR can help with spasticity. Also, the baclofen pump helps improve functional ability. Preventative and ongoing care, such as monitoring and intervening early for contractures, his displacement, and scoliosis. Also have lifespan care from childhood to adulthood. So why treatment matters? Since the brain lesions can't be reversed, experts manage the downstream effects.
I'm Corinne Mueller, and I'll be covering the story of Delilah and her day-to-day life with cerebral palsy. She says, I have mild spastic dysplasia, a form of cerebral palsy, and it has shaped me who I am. Growing up unaware of my diagnosis, I only knew that stiff muscles made walking, certain shoes, and physical activities difficult. The emotional impact, feeling different and trying to hide it, was often harder than the physical challenges. As a child, I avoided stretching because ignoring the issue felt easier, but it only held me back. My family's support, especially my older brother Christopher, helped me build consistency with physical therapy and stretching. Stretching with Christopher made me feel less alone and gave me the courage to work on myself. Learning more about CP showed me that it varies widely. Families should use reliable sources, like the CDC, and most importantly, offer emotional support as my brother did. I founded the Young Professionals Committee for the Cerebral Palsy International Research Foundation to empower young adults with CP. Discovering my CP helped me recognize my own strength, and I hope my work helps others find theirs. I want a future where people with CP are understood, supported, and embraced by the broader community. By sharing her journey, she hopes to encourage others to learn more about cerebral palsy and hopes to build a world grounded in greater inclusivity and awareness. Now for our closing statements with Kristen Tarter.
Thank you all for tuning in to CP News. In summary, cerebral palsy is a movement disorder caused by early brain injury. Symptoms depend on which brain region or regions are affected. History shows evolving understanding and increasing compassion. Modern treatment focuses on independence and support. We hope that this cerebral palsy segment was informative yet entertaining, and we'll see you next time. This is Kristen Tarter, CP News.